Hello, everyone, and welcome. Here in the studio, we have Matt Aloisi from Ohio Health Benefits. And tell me about Ohio Health Benefits.
Good morning, Dan. Thank you for having me on the show. So Ohio Health Benefits is celebrating its 20th anniversary this year. June of 2004, Steve and Kathy Clark, who are owners, along with a partner, Dave Aubel, started Ohio Health Benefits catering to the individual and Medicare client base. And for a majority of the 20 years, that's how they built their business. Mostly on referrals, relationships in the community. They've always been in the Talmadge area, and that's where our office is now. And we just felt as though our best business philosophy was relationship building and service. And that's how they don't do marketing, they don't do advertising. We just rely on referrals and Google reviews. We have 190 five-star Google reviews. We're really proud of that. And 2015, Steve and Kathy bought a retiring insurance salesman's book of business, and that's how they got into the employer group side of it. So we haven't been as long in that end of it, but we're trying to grow that. So I started with them last July, and that is my responsibility, is to help grow and facilitate the employer group side.
Your title is Employee Benefits Advisor. So what is your role? What is your day-to-day? You get to go into companies, meet with small business owners, and what do you get to do?
So the fun part of this is my wife and I owned a business before. We were franchise business owners for several years. So coming into it, I have that experience of knowing what small business owners face every day. The challenges of payroll and benefits and taxes and all the behind-the-scenes operations that go into running a business that aren't glamorous. Everybody thinks, oh, you own a business, so you're throwing cash up in the back room and jumping up and down. It's not like that. There is a lot of challenges, a lot of stress, and especially in this environment where everybody is trying to hire key people, having a benefit structure in place that is adequate for your staff is really important. So we cater to the 10 to 200 employee groups. We don't really go beyond that. That's kind of our niche. And I will go in and meet with either business owners or HR professionals and try to understand if they already have a plan, what they're doing with that plan. If they don't have a plan, try to establish a plan for them, whether it's a full-blown traditional medical, dental, vision, ancillary benefits, or if they've got something in place, making sure that it's running properly and that the employees are utilizing it correctly and that the employees are educated about how to utilize it correctly. One of the big things that we emphasize is education. Like any other business, if your employees don't know how to do their jobs and or use their benefits to their fullest potential, that could get costly. And what I mean by that is, for example, an ER visit is your most expensive option when it comes to healthcare. So keeping the employees out of the ER is key to better medical claims.
The small business owners in the 10 to 200 employee group,
yes,
there's probably a common thread. They probably have, no matter what industry they're in, similar challenges and maybe a similar feeling of feeling underserved, and that is a niche. There are maybe companies that would want to have a large group, large employers over 200, and then of course you have solo business owners, sole proprietors in very small groups that can handle their own thing. This is a niche market. What are the common challenges you see that you're addressing with small business owners in that 10 to 200?
So because we're smaller, we value those relationships and the service aspect. A lot of the challenges that these small business owners is they're wearing multiple hats. So they may not have an HR director or HR people to handle benefits administration. So what we can do is we can go in and try to help them with that. We have a dedicated group service team, so these employers don't have to try to call an 800 number with Anthem or SummaCare. They can call us directly as their first point of contact, and we can answer their questions. Say, for instance, an employee lost their ID card, something as simple as that. We'll make a call, get them an ID card. So taking some of the administrative burden is a big help to these small businesses.
What's the plus of local and your customers, your clients, people that you work for, advocate for, and assist, don't have to call a national call center. They're local, Talmadge, Ohio. Maybe most of your clients are within a 50-mile radius, perhaps. And what's the benefit to that?
So we are licensed for the whole state of Ohio, so I can go anywhere in the state of Ohio and write a health plan for a group. So that's really our only limitation. But being local, we can give that service. I can be there face to face. I can go on site for some employee meetings. I was just at a location yesterday where I rolled out and said, okay, we have a sheet that says where to go for care, because we don't want to assume that employees know where to go for care. Young, old, it doesn't matter. Some people just have never navigated the medical field. So they don't know that maybe checking in with the primary care is less costly and more efficient than going to the ER. They might wake up with a rash and go, oh my gosh, I better go to the ER. No, because that is your most expensive option, which means if they have a deductible, they're already paying towards that, and then the employer on the backside of it is their claims history goes up. So it's the education in going on site to help these employers educate their employees. And being there a phone call away gives them some assurance that they're not in this alone.
How do you feel about business owners that just reach out and have a conversation, may or may not do business with you, but you made the connection?
Love it, and I'll do it every day of the week. Mm-hmm. And especially, as I said before, being a small business owner, I understand what they're going to. And I've told other clients, if I can't assist them, still call me. It is worth it to me. We're in the community. I'm involved in a lot of different things.
You go to the networking, you go to the chamber events, you do all this stuff?
Yeah. We've got 7 children that are involved in different things. I'm involved in the BZA in the city of Talmadge. I've got active in my church. So I want people to know that we are a go-to, whether or not you're a client. Because if you're educated, and maybe today we can't do business together, but maybe in a year or 2 or 5 years, maybe we would be a good fit. But I don't want them to feel the pressure of a salesperson, and that's why my title is Employee Benefits Advisor, because I'm an advisor. I'm a guide. I want to give them guidance. I'm not a salesperson.
You're enjoying what you're doing?
Loving it.
That's phenomenal. I got that vibe. I'm glad we connected, and I wanted to have you on to share with our audience to get to know you and what you're all about. And a short interview, it's hard to do, but certainly you welcome any call. People that are watching right now that want more information can reach out, and of course, all the ways to reach Matt Aloisi and Ohio Health Benefits listed on the screen below and on the post and everything else. Leave us with one final thought for this area. The business community in Akron is solid. I've been in business in Akron here in 32 years, and I love this media program and all we're doing. Akron's a great place to be in business.
It absolutely is. I think what the chamber is doing, there is a lot of behind-the-scenes advocacy that is going on in this community. I think this could be the new South. I know a lot of people in this area are snowbirds. They like to go to Florida, South Carolina.
They're all coming back.
But I think they're all coming back because...
Come back to Ohio.
I think it's a great place. Our cost of living, the Midwestern values. So anything we can do to support our businesses, I think we're well on the way. So
absolutely.
Thank you for the time today, Dan.
Thanks for being with us, and thank you for watching. Matt Aloisi from Ohio Benefits have been our guest today, and we'll be back with more right after this. Stay with us.